Hello everyone, welcome to Marsha's classes. Today's topic is important antidotes. First drug is paracetamol. For paracetamol, antidote is N-acetyl Some important features of paracetamol overdose is nausea, vomiting. It causes paracetamol overdose causes the nausea, vomiting, right upper quadrant pain, right upper quadrant pain. It increases the AST, ALT. It increases the AST, ALT, bilirubin level, and it also causes the prolongation of PT, prothrombin time, prolonged prothrombin time in severe liver damages. Here one rule is there, one tool is there. The tool is used to assess the risk of liver damage based on the amount of PCM ingested. That tool name is RUMAC, RUMAC Matthew Namagram. This tool is used to assess the risk of liver damage based on the amount of PCM ingested. It also helps in decide if the antidote in a cetal system required or not. And the second drug is morphine. Morphine is a opioid. For this morphine or opioids, antidote is naloxone. It is used for pain reliever. It is used as pain reliever. When taken in excess, it causes the respiratory depression. Respiratory depression. It is the frequently asked question. Respiratory depression and CNS depression. Pinpoint pupil. It is also known as meiosis and bradypnea bradycardia. Bradypnea and bradycardia. These symptoms occur due to overdose of morphine in morphine poisoning. Respiratory depression is frequently asked question, and CNS depression will occur. Pinpoint pupil is also known as meiosis, and bradypnea and bradycardia will occur in overdose of morphine. And the next drug is heparin. For heparin, antidote is protamine sulfate. Protamine sulfate is antidote for heparin. And in heparin overdose, it increases the APTT level. APTT level. And the next drug is warfarin. Warfarin is a oral anticoagulant, and also it is known as blood thinner. For warfarin, antidote is vitamin K. Vitamin K. Warfarin increases the PT and ANR. PT and ANR. Next drug is atropine. Atropine is the anticholinergic drug. It blocks the acetylcholine muscarinic receptors. Muscarinic receptors. Physostigmine is a cholinesterase drug. Some important features of atropine overdose is xerostomia, dry mouth. It is also known as xerostomia and tachycardia, urinary retention, dry skin, dilated pupil. Causes a dilated pupil. It is known as mydriasis. And the next drug is magnesium sulfate. Magnesium sulfate mainly used in eclampsia and preeclampsia. For this magnesium sulfate, antidote is calcium gluconate. Some important symptoms of magnesium sulfate overdose is hypotension. It causes the hypotension, hyporeflexia. In severe overdose, it causes a bradypnea and bradycardia also. Bradypnea and bradycardia. ECG changes in overdose of magnesium sulfate is prolonged PR interval. Prolonged PR interval. Next, for iron overdose, in iron poisoning, antidote is deferoxamine. Deferoxamine is antidote for iron. After administration of this deferoxamine or desferal, it causes the red or orange color urine. For this, no need any intervention because it is a normal finding. And the next one is carbon monoxide. Carbon monoxide. For this carbon monoxide, antidote is 100% oxygen or H-boot. H-boot. The meaning of H-boot is hyperbaric oxygen therapy. 100% oxygen need to be. In carbon monoxide poisoning, the important feature is cherry red discoloration occur. Cherry red discoloration occurs at trunk region. It is an important feature of carbon monoxide. And the next one is digoxin. For this digoxin, antidote is digoxin immunifer or diziban. Diziban. Digoxin. Digoxin normal therapeutic level 0.5 to 2 mg per ml. The toxicity is known as more than 2.2 mg per ml. Digoxin should be stopped if heart rate is less than 60, in children less than 80. And it causes a hyperkalemia also. The anorexia, nausea, vomiting. These are primary symptoms of digoxin. And this is digoxin is a yellow coated drug. This digoxin is yellow coated drug. The next drug is benzodiazepine. For this benzodiazepine, antidote is flumazenil. Benzodiazepine drugs are alprazolam, lorazepam, and clonazepam. These are all benzodiazepine. These are mainly causes of CNS depression, sedation, dizziness, lethargy, and ataxia. Respiratory depression also occurs. It is a life-threatening condition in benzodiazepine poisoning. For this benzodiazepine, flumazenil is the antidote. And the next one is methanol. For this methanol, ethanol is the antidote. Ethanol is this methanol is also known as wood alcohol. Next one is potassium. For this potassium, specific antidote is calcium gluconate. Potassium. Antidote for potassium is calcium gluconate, and the drug used for redistributing the cell insulin plus dextrose. 50%. dextrose. It is used to redistribute the potassium ions into the cells from bloodstream. And K plus binder. K plus binder used to eliminate the potassium from the body. It is used for elimination. The antidote is calcium gluconate. Redistribute the drug used for redistribute in the cell, that is insulin and 50% dextrose, and for elimination K plus binder. Next one is arsenic. For arsenic, antidote is dimercaprol. This arsenic is colorless, flammable, non-irritating, toxic with a mild garlic odor, gas. Features of arsenic arsenic poisoning is raindrop appearance and brownish pigmentation of the skin. Measline means 1 to 2 millimeter white bands across the fingernails. Black. It also causes the black foods. Measline. Measline. It also causes the black foot disease. Black foot disease and raindrop appearance. This raindrop appearance means dark spotted pigmentation on the skin or brownish pigmentation in the skin. Black foot disease means gangrene. It is also known as gangrene of extremities. Gangrene of extremities. This means line is 1 to 2 wide, transverse white bands across the fingernails. White bands across the fingernails. Fingernail, fingernails. And the next drug is copper. For this copper, antidote is penicillamine and trientine. These two are the antidote for copper. The important feature of copper overdose is jaundiced skin, vomiting. This vomitous color is green or blue in color due to presence of copper. Green or blue in color due to presence of copper. And green purple line on gums. Green purple line on gums. These three are important features of copper overdose. And the next one is methotrexate. For this methotrexate, leucovorin is the antidote. Methotrexate, it mainly inhibits the folate metabolism. Commonly used in the treatment, this methotrexate commonly used in the treatment of cancer and autoimmune diseases. It is also a teratogenic drug. It causes the it inhibits the metabolism of folate in the pregnancy and it causes the NTD neural tube defect mainly. For this methotrexate, leucovorin is antidote. And the next one is isoniazid. For this isoniazid, pyridoxine is antidote. This isoniazid is used to treat the TB. Pyridoxine or vitamin B6 is the antidote for isoniazid. Next drug is sulfonylurea. For this sulfonylurea, antidote is octreotide. This sulfonylurea drugs are glimepiride, glyburide. These are drugs comes under sulfonylurea. These drugs mainly encourages the insulin secretion from beta cells, and this octreotide it is a somatostatin drug and a synthetic analog of somatostatin. It inhibits the release of insulin and it acts as an antidote for sulfonylurea. Next drug is thiophyllene. For this thiophyllene, antidote is beta blocker. This thiophyllene mainly used in treatment of asthma, COPD, and other respiratory conditions. For this, beta blocker is antidote. Now the next one is nitrate. For this nitrate, methylene blue is antidote. Nitrate is used mainly in angina, nitroglycerin, angina, and for this nitrate, antidote is methylene blue. Next one is cyanide. For this cyanide, antidote is amyl nitrate and sodium nitrate thiosulfate. And the next one is lead. For this lead, antidote is dimercaprol, succimer, and calcium disodium EDTA. This lead poisoning is also known as plumbism. One main adverse effect of lead poisoning is blue stippled Burtonian line on gums. Next one is beta blocker. For this beta blocker, glucagon is antidote. Beta blockers are propanolol, atenolol, metoprolol. The adverse effect and overdose of beta blockers are bradycardia, bradycardia, hypotension, nausea, vomiting, and dizziness. And the next one is aspirin. For this aspirin, DMSA is antidote. The meaning of DMSA is dimer-captosuccinic acid. This aspirin, also known as acetyl salicylic acid, is a frequently asked question. Some important adverse effect of overdose of aspirin is tinnitus. It causes tinnitus, ringing sensation in ear, and dizziness, disturbance in vision, disturbance in vision. It mainly causes the acid-base valence metabolic acidosis. It causes the metabolic acidosis due to presence of acid in aspirin. And the next one is scorpion sting or spider bite. For this scorpion sting and spider bite, prazosin is used as antidote. Antidote. These scorpion stings and spider bite causes the vasoconstriction and the sympathetic nervous stimulation. This prazosin, it is alpha-1 adrenergic receptor or alpha-1 blockade. It is also known as alpha-1 blockade. It dilates the blood vessels and it decreases the BP. It dilate the blood vessels and it decreases the BP because these causes the vasoconstriction and increases the blood pressure and it reduces the sympathetic nervous system. For the scorpion stings, rajosine is antidote. Next one is insulin. For this insulin, dextrose 50% dextrose is antidote. Overdose of insulin causes hypoglycemia and for this for this hypoglycemia we need to give dextrose 50%. Next one is organophosphorus, neostigmine and mushroom poisoning. This organophosphorus it inhibits the acetylcholine esterase enzyme and causes the continuous stimulation of muscles, glands and CNS and it increases the salivation, lacrimation and urination and defecation. It also causes the GI distress, muscle twitching, muscle weakness, bradycardia, sweating, respiratory depression. For this all, atropine is the antidote. It blocks the excessive effects of acetylcysteine. And the next one is universal antidote. It is also known as this activated charcoal is also known as universal antidote because it absorbs a wide range of toxin in GI tract from prevent their absorption into the bloodstream. That's why it is also known as universal antidote. These are some important antidotes related to exam. Thank you.